Online reviews, they're the new word-of-mouth advertising. Negative reviews, if you do not address or properly handle them, can cause major problems for your dental practice. Now, after the break, I want to tell you how to deal with dental patients and prospects who badmouth you online. Stick around. I'm Colin Receiver, founder and CEO of SmartBox, and thanks for tuning in to the Patient Attraction Podcast. Now, this is the first of a three-part series about online reputation management, and that's a fancy way to put your reviews online. Now, Google has said that people will consult 10.4 sources of information before they make a buying decision. Reviews by consumers are at least one of those sources, if not two or three. Now, if your dental practice is getting bad reviews online from unhappy patients, then your prospects are far less likely to choose you to be their dentist. Review sites, they're springing up like weeds. Yelp, Healthgrades, Angie's List, the Better Business Bureau, and many others, including your website maybe, give unhappy patients an online voice. It's easy to shrug off complaints, but dentists ignore bad reviews at their own peril. Bad news travels fast, and that includes reviews. So here are 4 tips for online reputation management. Number 1, monitor reviews frequently, if not constantly. You can't fix something if you don't know it's broken. Google Alerts can notify you when your practice is mentioned online. And there are also some software programs that will notify you or collect all of your reviews. If you do get a negative review, you need different approaches for unfounded versus founded complaints. Unfounded complaints are best handled publicly. You can gently explain the misunderstanding or misperception that led to that complaint. Now, never react defensively or belittle that reviewer. Keep a helpful, concerned but firm tone that lets you establish that you're not in the wrong here, but you're still willing to address their issue. Now, you may find that your happy patients will publicly take your side. Founded complaints need different handling. Now, unless you're willing to publicly fall on your sword, which sometimes is the only thing to do, try to reach out to that legitimately unhappy patient offline. A phone call, a personal email, a letter, or even an arranged personal visit can go a long way. Now, if you're in the wrong, readily admit it and apologize. Within reason, offer something to make amends for the failure in service or that poor experience. Now, if possible, ask the patient to revise their review to reflect their new satisfaction with your practice. You're not going to win them all over, but they'll be less likely to vent even more online. Tomorrow's podcast continues our 3-part series. Until then, keep moving forward.